Okay. Then this is the Kern Valley Healthcare District Board of Directors meeting. It's Monday, October 10th, and we are called to order. Do any members of the board have any changes they'd like to see to the agenda?
Okay, one thing on the new business,
Okay,
under funding. Whenever I requested to be on there, I was intending on talking about where the money comes from and how do we get it and how we get where we're going. And I see Bob's on here for showing where we're at. We're at almost twice what we were. But I want to make sure we understand we'll be able to talk about how we're going to get twice as much money.
okay, well, we can talk about that when we get to it. I don't know that the report provided that information, but maybe we can get that.
Okay, yeah, well, we got Dave here. He knows everything.
He does.
So, okay, well, I just want to make sure we could talk about that. Okay, thank you.
Thanks, Gene. Okay, if there are no objections, then we'll accept the agenda as proposed and move to our flag salute. And Catherine, are you okay doing the invocation for us today?
I am.
Thank you. So, Bob, could you lead us in our flag salute?
Okay, we'll give it a shot. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Lord, I just want to come before you and thank you for the progress that we're making on the hospital, Lord, and that you're keeping an eye on the funding that will help us to do that, Lord. I just ask that you continue to be with the patients that we have inside, the residents, and those that utilize our facility. I ask that you be with each board member and our associates, and I just ask that you continue to oversee us. Ask all these things in your name. Amen.
Thank you, Catherine. Thank you, Bob.
You're welcome.
Our mission statement is provided here on the agenda. We still stand by that and strive to do that every day. We'll move to public comment. Item C on the agenda. This portion of the agenda is reserved for comments by members of the public who would like to address this board on matters that are under our jurisdiction, but not on today's agenda. Do we have any members of the public wishing to be heard? Okay, seeing none, then we will move to the consent agenda, item D, and all the items in item D under consent agenda will be considered and approved in one motion unless a member of the public or a member of the board desires to have an item discussed individually. So are there any members of the public or any members of the board that want to remove an item from the consent agenda? Okay, seeing none, I'll entertain a motion for approval.
Motion as such, Ross.
Thank you, Fred.
I'll second.
Thanks, Catherine.
I do have a comment.
Okay, Bob.
There's a renewal under Q on contract. Site FM is no longer. We have switched to a different company because the supplier of that work order program removed it from the market. So it can just be stricken. It's not, we don't need it approved.
That's on contract review though. That's not part of the agenda.
Well, it's item 5. It's item 5 of
Okay,
consent
okay, I
agenda.
thought okay.
Item 5, number Q.
Okay, but that's contract review. I thought that was separate, Russ.
Well, what we're doing when your committee has these placed on the board agenda, we're basically as a board agreeing to continue with these contracts.
Okay, well, then I've got a question too then on Delta Liquid Energy.
The only reason it's on there is that the new administration building is currently still with Delta. as soon as we get the remodel
That's
done.
still with it. When did it get with it? It never was with it.
Yes, it always was. The previous owner of
The
the building.
previous owner had it. We didn't do a contract with
Hey,
it.
gentlemen, hold on a sec. What we're talking about right here is what we're going to approve on consent. So we will
Okay.
remove item E from consent and we will remove item Q from consent.
That's fine.
Okay, okay.
Okay, and then we can talk about those immediately after we take action on the consent agenda.
Okay,
Okay, so we have a motion and a second.
Ross, do I need?
Fred
to-
and Catherine, go ahead, Fred.
Sorry, forgive me. Do I need to change that motion with the changes that were presented?
Yeah, to have those two items removed.
Thank you.
You all right with that, Catherine?
I am.
Okay, then Fred, your vote.
Yes.
Catherine,
Yes.
John,
Yes.
Jean,
yes.
and I'm a yes. So let's then move to discuss item 5 and Delta, item E, Delta Energy, and Bob, you were saying what exactly?
What it is that when we purchased the building, the tank, the current propane tank
That's
is.
what I was talking about.
Oh, I'm sorry. I
Q.
thought you said E.
We're gonna talk about the other one afterwards. Q, he wants to know what you're gonna do.
No, you said 5.
I was just moving down in order, Tim. I was just going with E first.
I thought we were gonna move that to new business. That's usually what we do when we pull it off consent.
I just want to deal with it now and get it done.
That's your call. Okay.
Okay, just in a nutshell, when we purchased the building, the tank that is sitting there next to the building belongs to Delta Liquid Energy. So it's still there. And so I'm assuming they have an annual renewal as far as, the contract to fill it, because right now they do monitor it and they will fill it as needed. Obviously, it's summertime. We're not filling it right now, but so that's why it is on here. The reality is, as soon as we do the renovation, we'll be switching over to Kern River propane along with the rest of the hospital properties. It's just that because I'm not doing any work down there and we weren't using any propane, I didn't move forward with having that tank pulled and one place by Kern River.
Okay, and like you said, they're not gonna make any deliveries to it.
Well, they would if it gets low.
Well,
But currently, right now,
do we
it's
have a
not going.
contract with them? They, as far as they know,
To my knowledge. I
the
don't
old
think we
people
do.
are still in there.
How did, Barbara, can you answer that? I mean, did that just come across with the purchase of the building? Is that all, or? To my knowledge, we don't have a contract with them either.
It can't, we just started getting the invoices once we took possession of the building.
Okay, so there is no contract per se.
How did they know we took possession?
That I don't know.
I think
Yeah,
Well, how did we
they
start
know,
getting invoiced?
they notified them.
Let me explain. We were
Okay.
working on the building last winter and we needed heat. So I just called Delta Liquid Energy because they owned the tank and asked them to fill it. So that's why we got an invoice.
Now, you have agreed and we have agreed that we're using Kernville Paint. The
Yeah.
thing would have been to call them and say, hey, put your tank in here. So how much are we paying? You don't care what
No
we're paying?
different than we're paying with Kern
You
River.
don't care what we're paying?
I said, we're not paying any different than Kern River.
How much are we paying?
I don't know off the top of my head.
How
Barbara,
much are we
you have to
paying,
pull it in.
Barbara, and how much are we paying for Kern River?
I can look that up if you want and give it to you in a few minutes.
Yes, please.
Okay.
So let's table this and Barbara, let us know when you have that collected and we'll discuss that again when you have that data.
Okay.
Thank you. Okay, so let's go on to that site FM, the hosting maintenance work orders. So they're out of business, Bob? We don't have an agreement?
The company is not out of business, but the company that owned the Site FM program chose to close it down. So we have switched to a company called QWare, Q as in the letter Q. And so I'm just saying that Site FM does not need to be renewed as a contract.
Okay. So no actions required by the board? There's no entity to contract with?
Yeah, we already signed a contract with QWare.
So
All right.
that'll show up. That'll
Yeah,
show
it'll
up.
start showing up, right?
Right.
Then Barbara, are you still there?
Yes,
Can you take that site FM then off your list?
yes. Actually, we probably should have removed it before it got on here because I did say at finance that we were not continuing because it had switched.
Okay.
And I believe, Barbara, didn't we talk about approaching Site FM's parent company about giving us a refund for the months that they are not covering?
Yes, but I don't know where we're at with that right now.
Okay,
All right. So no actions required on that item. So we'll get back to the Delta propane or Delta liquid energy in a few minutes. So then we will move on to item E, reports, and we'll begin with our foundation report. Debbie, are you there?
No, she's not. I've got her report.
Okay, thank you, Tim.
Yes. So the auxiliary report.
Foundation.
Foundation report, basically Crab Fest was a great success. We have identified some things that we would like to change. Overall, everyone had a good time. The silent auction brought in over $5,000.
Wow.
Yeah, we haven't completed the accounting to have all overall income. We will be heading up another diabetic class beginning October 26th, November 2nd, and the 9th. That will be held in the hospital conference room from 5 p.m. to 7 p.m. So that was her finance report, or her her foundation report. Thank you.
Thanks, Tim. Okay, you want to do the auxiliary report as well?
Yeah, actually a very short report here. So the auxiliary is moving forward. We've had some barriers to overcome, but everything seems to be moving forward in a very positive manner. For the month of September, the thrift store made a little over $6,000. And that's what you had to say.
Okay, questions, comments? All right, thank you, Tim.
You're welcome.
Then we'll move to item 3, medical staff report. Hello, Dr. Finstead.
Hi there, Ross. Thank you. In September, there was an abbreviated schedule of meetings as I was gone for a good part of the month. But the medication error reduction program did meet on September 15th and reviewed their and discussed the regular reports, including medication events, both by severity and by location, medication error and adverse drug reaction alerts and reports, along with the medication pass activity tracking. And then the surgery committee met on September 26th to discuss the need for an additional eye wash station to be installed. They also discussed the possibility of bringing back GI services and trying to increase their surgical cases. Now, I don't have any further information. I don't know if Tim has any information regarding possible GI cases.
I'll discuss that in my report. Yeah.
Okay, great. And then they reviewed their regular report on surgical site infections. And unless there's any questions, that's the end of my report.
That is abbreviated.
We are back to our regular schedule of meetings in October. So next month, there will be a 2-hour report.
Any questions or comments for Dr. Finstead? All right, sir. Thank you.
You're welcome.
Okay, Tim, Chief Executive Officer report.
Yes, Dr. Leho's building. I had an opportunity to talk with him before last. He is agreeable to a 3-year lease with option to buy. He said the hospital wants to buy sooner than that. We can do that, no problems, whatever. We need to work. I need to work with Scott to craft an agreement. He forwarded us his prior agreement with BFMC, but much of it was unreadable. And I think was probably one of the most complicated long lease or agreements I'd ever seen. So I want to see if there's a way for us to simplify some of that and get that done. He was very, very agreeable to having us in there.
Did you agree on the cost on?
4,000, it's asking for the whole building, so. Which
400,000.
is very, huh? Oh, not for the price, not yet.
Oh, okay.
So
Okay, so 4,000.
4,000 a month for the.
We're already paying 3,800
33, yeah, something like
or
that.
33.
Yeah, so
Yeah,
pick
cool,
up the rest of it.
cool. Good job.
So anyway, that's what's going on with that. So I'll get with you, Scott, sit down and put together a lease agreement that makes sense. As Dr. Finstad brought up, Dr. Buxton has agreed to start doing surgery again. And he'll be starting shortly. I went over and met with the staff over in the clinic. I guess we're going to be helping him. That's November 7th. November 7th, we'll be back. Okay, good. And then he indicated that there is a possibility that he may have another surgeon who might be willing to come up as well on the weeks when he's not there and so forth. So he and I are talking about that. GI is still trying to work with Dr. Bogle. I'm going to have to meet with Dr. Bogle personally down there. I think it's going to be easier we'll be doing back and forth with emails. And so if we're trying to get the GI finished once and for all, that's my goal for this week and next week. And then we had a meeting with Stockdale Radiology, Dr. Swati, last week, and he is very interested in partnering with us to put in a mammography service. And our thought was that might be something we could possibly do at the Leho building or somewhere else. And so they have access to equipment, refurbished equipment at low cost. We had money budgeted in our capital budget for a mammo unit and so forth. And very positive, very nice folks. I met with everybody down there. And they really specialize in women's care. Would like to see us develop more in that regard. So anyway, and we've looked at that. We're looking at them possibly, again, we've been having some issues with regional imaging with regards to some billing stuff, as you're aware. And so we're talking with them about the possibility, if things don't work out with regional, that we might be able to switch over our imaging to them as well. And they are happy to do that. So they have contracts with Heart Hospital and also with Good Sam Hospital for doing all their readings and so forth. So then I had a conversation with the CEO of Current Health Systems as CalAIM effects get underway. The health plan will be looking to partner with providers to provide their members services, in particular skilled nursing beds. They are very anxious and chatting with us about moving patients up here. They're currently sending patients out to Lancaster and beyond for SNF, just primarily because of the quality of the services that are provided in Bakersfield. And so I said, we'd be happy to talk to them about that. We have capacity and per CDPH, we had the best SNF in the county. So they're real happy to hear that. So I'll be meeting with them probably next week. I have a strategic planning meeting coming up with them this Friday, as a matter of fact, which is the last thing on my list there. So really just wanted to make sure that we're represented in their plans going forward, especially with some of these CalAIM initiatives that they're underway with. So this is one I think that we would fit in nicely with. That's our ability to handle some of their patients for SNF and potentially other services. So as we know, we've been working with them on our transportation. That also is a CalAIM initiative and trying to make sure that people have access to services. And so I'll leave it for Mark. He should have come out here. He could have pointed things out.
All they have to do is look out the window, they'll see it.
Right. Next to my car is the new vehicle that we just literally picked up
It's some nice.
about
I
a
looked
half
at it.
hours ago.
Very nice.
And so Mark just brought that back from Bakersfield. So it's gorgeous. And so Current Health Systems paid for that entirely. And so we're very happy. And that car will be, I'm getting to Mark's report probably. So anyway, I'll
Yep.
stop. Anyway,
Hey.
that's my report.
It's just that many fewer words I have to say.
I don't mind sharing.
Any questions for Tim? Questions or comments?
Tim, I've got a comment. So when you talk to Dr. Bogo, if you can tell him that we miss having GI services up here, and I would like to see some of the current GI docs back up here again.
You bet, will do.
Tim, on the SNF bed proposal for Kern Health,
Yeah,
what kind of time frame are we looking at? Can we start that like next week?
possibly. Yeah, a lot of it for us, again, is still going to be dependent upon staffing. And we've been doing a little better in there. We actually have a waiting list right now of 10 patients for SNF. We've got 2 that are being admitted this week, and then we've got 8 more behind that. So we are, trying to shore that up with some additional staff. We can actually take on a few more, I believe, with our current staffing. So we're going to try to do that. But
We took one on this morning.
Right. And so we've got another one coming in this week as well. So, yeah. So yes, and answer your question, that can start pretty quickly.
Is the staffing at the management level or at the bed level?
Bed level.
Okay. Is that CNAs or RNs?
CNAs and LVNs, yeah.
Okay. So are we retaining our CNAs? Are we still losing them?
Mark.
So we just put a class together that we started out with 10, we graduated 6, and we actually had 3 come apply for jobs here. The problem is that the American Heart Association stopped doing the CNA testing. So to get certifications, you had to go to a specific American Heart Association accredited testing site just for the test itself. Well, when they stopped doing that, these other testing sites opened up, and it's hard to get into those. So we have 3 people who are pending the CE. They've already graduated the program, but they don't have their continuing or their
Certification.
actual certifications yet. I guess it would be the COVID covering that said that they could work in a facility without this, while they're pending that certification expired for them on September 30th. So there, 2 of them were taking their test. I think on October 2nd was the last I heard. And then the other one has been in the hospital, so she could not even schedule her testing. So we did get 2 people from that last class. I reached out 4 weeks ago, I think, and got 3 CNAs from a registry program. And it's always a, I want to say a crapshoot when you get registry CNAs, because half the time it's just, you never know what you're going to get. And so we have scheduling difficulties with those folks and things like that. So as far as staffing is concerned, I think that within the next couple of weeks, we'll have 5 new CNAs that we can actually use on the floor, which will definitely help bolster some of those numbers. Now, I will hesitate and say that those CNAs are on 13-week contracts. And so once the 13-week contract is up, if we don't renew it or they don't want to renew it, we're back in the same boat where we lose 3 CNAs. So it's a kind of a delicate balance between the getting folks in here to admit it, because they're going to be here a lot longer than 13 weeks. That's kind of the dance and the balance that we're dealing with. So
yeah, one of the things we're trying to do is to spread those contracts out so they overlap, and so they're not all coming due at the same time.
right.
So that way we can be down 1, and with 2 still here under contract and stuff like that. So that's something we're trying to figure out.
And a lot of times we're more than willing to extend their contracts out further. It's just,
Absolutely.
obviously it's up to them.
So typically we pay through the nose for registry personnel. Is that the same with the CNA?
The CNAs, Tim, you want to tell them the number?
I think it was $50.
During COVID, the height of COVID, it was 60 for a CNA, $60 an hour. right now we've negotiated it back to 40. So, and with COVID kind of diminishing and decreasing, I see those numbers going down even further. But those are just devastating numbers for a facility like us to try and use, you know.
So a couple things come to mind. If, you know, if we're paying that much for CNA, which I realize it's temporary and we're trying to put a Band-Aid on a long-term problem. And I know we've already bumped up the CNA salaries once or twice. Maybe we should consider doing that again. You know, if we're willing to pay $40 or $50 an hour on a temporary basis, maybe we should be paying more than what we're paying now on a long-term basis in order to get people to stay. And secondly, you know, we're doing what, 2 classes a year. How do we step up our training program so we're doing 3 or 4 classes a year so we don't have these long gaps?
I've been looking into that. I have one of my LVNs who has experience over there. He's actually doing his director of staff development right now. And we could probably step that up once this gentleman accepts kind of the responsibility for that. I'm kind of tiptoeing into that. And I don't want to say too many things, but there's in Dave's budget, there's another person we put for this very reason into the education budget. And so now I have the individual lined up to kind of start working in that role. And so he'll be doing that plus a clinical informatics kind of place. So there'll be a couple of things that this LVN will do. And I'm pretty excited about it, but he's doing his DSD program right now. And then we'll get him approved, and then we may be able to do more classes per year. The other thing is you always have a struggle completing the classes. We started out, as I said, with 10. We graduated, I think 5 or maybe 4, Sarah Ramos, 5, we graduated, but we only kind of got 3 that were interested in coming to work here.
Yeah, that's the attrition, you know, that's going to be what we're dealing with every
Right.
class, I'm sure. Yeah.
Yeah, I think that you might have, if we do what you mentioned earlier and start showing that we're willing to pay a little more, there might be a little more attraction in getting those people to take the program and to actually do the work. So I don't know. It's that's a slippery slope as well. And Dave could probably speak to that better than I could.
Well, I know the costs with that are, you know, more than just that particular position. I know that you start getting compaction, and then it kind of forces an across the board increase for a lot of people.
The news I'm hearing today from Tim that there's more referral sources on adding to our census. I would be more than open to doing whatever's necessary and look at it as kind of a long-term project that, you know, we want to ramp up our capabilities over the next 2-3 years to really get our census, you know, significantly higher than it is today. So we want to really be committed to paying as much as necessary and also enhancing the educational opportunities.
Yeah. But, you know, the board has talked a lot about the census in the skilled nursing facility. And we've been talking about this since I've been on the board over basically the past 4 years. And, you know, we've taken some significant steps. We've addressed the pay level. We've started this training program. But, oh, golly, we're just not there. We have 10 on the waiting list that we can't admit because we don't have the staff for it.
And as the demand increases, it clearly removes a lot of the risk of us really starting. We need to be ramping up our investments in those positions so that we don't have that situation where we can't take a patient, because it's financially it's well worth it for us to spend whatever is necessary and get the census back up again.
Yeah.
And I will say, in all fairness, that 2.5 years of that, we had a pandemic going on that really sequestered and quelled some of that
Well, that's a very good point. Absolutely.
quenched our ability to even take admissions.
Yeah.
But I think as a general mindset, like I said, over the next couple of years,
I would
we'll be
agree.
putting more and more emphasis and dollars into that part of our budget.
All right. Thank you. Thank you, everybody. Tim, anything else?
No, I'm good. I was back to
Now,
Mark.
that was your report.
I guess so.
Okay, can I ask him a question?
Sure.
The Zoom meetings,
Yes.
I understand they're gonna change it back to where it's sort of like it was before, and it's gonna be an exception if we zoom in.
I have not heard that yet.
Okay.
As long as we're under the health emergency,
When's that
We
gonna
can-
expire?
at this point, I believe it was extended through into January. Greg,
Into
it
January, yeah.
was into January sometime.
Okay,
And they're doing it like 3 months at a time and stuff like that, just to keep pushing it down the road. So, and I think, again, we may see some changes from the state at some point down the road. That might continue this because now it's become such a big part of all businesses that they're using Zoom or Zoom-like meetings as a way of cutting down
the state of
transportation.
California,
State
do you
uses.
think there's a
fair amount of-
possibility somebody would take over the state of California? Some other state?
Let me say that Zoom has
I'll
always
leave
been
that. That's
legal.
it. What's that?
Zoom has always been legal under the Brown Act, and I've had agencies who have been doing video since the early 2000s. So COVID did not change that. And when the state of emergency goes away, you will not lose the ability to do Zoom, and you will not lose the ability for directors to participate remotely by Zoom. The two main rules that affect you under AB 361 that are a result of the COVID state of emergency is one, you don't have to put the addresses for the locations of directors who are appearing remotely. And that is because of the social distancing policy under the General Brown Act rule. If wherever a director is, the public has to be allowed as well. But with COVID, that is not the case. The other General Brown Act rule is 3 directors have to be located within the district boundaries for a meeting. So you have to have a quorum inside the district. All 5 of you can be on Zoom as long as 3 of you are inside the district. Under AB 361, that rule is suspended. So all 5 of you could be in different places around the country or world, and you'd be fine. And then the last point I want to make is the fact that you are doing this is entirely optional. AB 361 is not a required procedure. And so you could choose not to do AB 361 and return to your normal in-person meetings and return to the normal Brown Act rules. if you would like.
Now that, as a board, you mean, we would decide as a board or each individual board member?
So if the board declined to adopt the AB 361 resolution, then you would go back and you would operate under the normal Brown Act rules, and you could meet in person. Although individual directors, if they could not attend a meeting in person and had to appear by Zoom, they could do that as well, as long as 3 were within the district boundaries.
Okay, cool. Thank you.
And all of my other agencies have declined to adopt AB 361 and all are meeting in person, including my hospitals.
Yeah. John's the only one that would upset the apple cart and so.
Yeah,
that's the problem.
I've zoomed in from Canada and
Yeah, right.
Arizona.
It's
Okay.
very convenient.
Public going there.
Yeah, thanks, Scott.
So we can't take action on that because it's not on our agenda, but does the board give me guidance on this? Do you prefer to resume back to our face-to-face meetings?
Just one other comment, Ross, along those lines. California is also kind of looking at adopting the same masking policy as well, where there may not be a requirement for masking outside of a patient care area, which would mean the boardroom would not require masking. So that hasn't taken effect yet, but there is talk of that.
CDC has approved that, but the state has not yet.
The only difference, one difference, Russ, you would have to open your doors and make it public if you want to continue doing it the other way.
Right.
Scott, and now Fred and I could do it just, at our office and not have an issue.
That's true.
And so
You
you
just have to post the address on the
but
agenda.
right now, we're good till January, apparently, the way we're going, and nothing has to happen, so.
Actually, every month, so in your consent agenda, you have the AB 361 resolution that you have to adopt every month in order to continue to operate under the modified rules. So if you had not adopted the resolution today, then your November meeting would have been under the traditional Brown Act rules.
We're good. I'm good to go the way we are. It's great. I heard that maybe in January it might change to where it's subject to change in January. Maybe they might make it more difficult.
We'll wait and see. A lot of it's going to depend upon the incidence of COVID and what's going on. I mean, I've
Okay.
been hearing some reports that
Okay.
they're expecting it to start going back up again.
So we're good till January.
Yeah.
All right. Cool. Thank you.
All right. Well, Mark, we haven't heard from you today.
No, it was lucky that I made it because I was traveling back up to Canyon just about 12 o'clock. I thought it was 11 o'clock, but anyway, the time on the dashboard of that new vehicle out there is an hour slower. So anyway, the point, so my report is the COVID numbers in the month of September were around 5.5%, which is mediocre. October has seen a sharp decline as the first 10 days were at 1.1%. So we just talked about masking. It continues to be required in the facility where patient care is carried out, as well as out in the conference rooms. So we'll anywhere on the district grounds, we're still going to adopt that. There was some concern over patients who are coming to our retail pharmacy complaining about having to wear a mask, and it's just a requirement, and people don't bring masks in and they just want to get their drugs and go out. But we're kind of trying to enforce a mandatory masking where it's not enforced anywhere else in the county, I suppose. So anyway, we continue to adopt those.
So let's talk about that for a sec.
Okay.
I realize that because the healthcare district owns that facility, we're treating it as a hospital. And so you're required to wear the mask, but is that a strict legal interpretation, or do we have some flexibility there?
I'll defer.
I believe there is flexibility there. Again, we offer masks down there for people that do want to wear them. CDPH is kind of looking at all facilities where healthcare is being rendered. So the question is that considered healthcare? Or
We're not rendering up. We're private.
We're
The
public.
pharmacy.
The pharmacy is public, though.
The pharmacy is still listed.
Exactly. So that was my understanding too, is that they're still listed, but
Scott,
we're taking them, we're following the rules where, the CDC puts out there, and they have identified pharmacies as one of those.
Well, if they would require that of Rite Aid,
Yeah.
I could see it would apply to us, but if it doesn't apply to Rite Aid, why would it apply to our clinic? Or I mean, our pharmacy?
Scott, do you have what do you say? I thought that we were licensed privately, the pharmacy, although we own it. I think it's operated as a private pharmacy.
It's a public agency, just like the hospital and the clinic. You don't have any private entities or operations under the district. You're all public. What I'm starting to see is some healthcare facilities are requiring masking everywhere. And some are starting to shift their masking to just patient care areas. So lobbies are not having masking, or areas where patients just aren't being treated. You're not seeing masking. Frankly, I've heard of some who've just stopped masking altogether. So you are, I think, under the strict letter of the regulation, you are required to have masking at your pharmacy. But we are starting to see facilities that are not strictly following that requirement.
Yeah, some of that again is because CDC about a week or two ago came out and changed their requirements, basically saying that masking is no longer necessary. Even in public areas, even where care is being provided, as long as there's not like an outbreak of COVID going on, they changed their rules from required to recommended. And so, which basically leaves it up to the facility to make a decision as to which way it wants to go. The federal requirement also stipulates for in non-patient care areas that you don't have to wear masks and so forth. And that may be why some of the hospitals are beginning to change, because they're looking at CDC as their guideline. But the bottom line is the state is still ultimately, since we're licensed by the state, they still take precedent because they're more strict than the federal government. So that's what we have to follow.
Yeah.
So
Speaking of that, I did notice that a few weeks ago, I was a patient at Cedars-Sinai. I had to get some blood work drawn, and there were some areas in the facility where you didn't have to wear a mask, but it was non-patient related, like Scott said, lobbies, but they were still doing temperature checks just as a.
And like I said, there was no point for even doing that, because now they're not even requiring us to validate whether someone's had COVID or had a vaccine or whatever. We just have to be able to provide access to COVID testing if necessary. If someone feels like they may be symptomatic or whatever, we have to be able to provide tests for them. So, which we still do.
So are we providing care or providing services in our pharmacy to the public who's not wearing the mask, or do we have them leave?
No, because probably most of our staff is behind windows or behind shields. So we have no problem doing that.
Okay.
You know, we try to do that, try to get them to wear them. You know, we offer them the masks and so forth, but you know, our bigger concern right now is making sure that they get the meds that they need, you know.
And frankly, some of those people are very aggressive. When you ask them to wear a mask, they want to get really in your face about it and get angry. And we're not in the business to fight them about it.
Yeah.
We just ask them, all right, could you wait out in your car? We'll bring your meds out to you or something like that.
And our staff are wearing theirs, so they're getting the protection from that. So technically we're okay.
Okay. Sorry, didn't mean to interrupt, Mark. Thank you.
No worries. So as you all know now, I have chosen another vehicle. Man, was that a hassle. I go to new car places and 6 to 8 month delivery times. They're telling you, I said, I have X amount of dollars in cash money. I just want a car, and they have none. So I went down to Bakersfield twice. I went to Ridgecrest once, looking for a specific vehicle that would satisfy a 6 to 8 passenger need. So what I did is I finally went to CarMax, and CarMax had one in Burbank that they found for us. And I was able to purchase that. I went down this morning, as Tim was alluding to, and I picked that up. And it's, I can show it to you guys outside, whoever's on campus after the meeting, we can go out and look at it. It's a great car. It's got a navigation. It's got a camera system that looks in the back seat, so you can, and as well, it's almost like a bus driver where you could talk to the patients or the people in the back. It's really kind of cool. We wanted a camera in all of our vehicles just for documentation of the trip. Some people have said, you know, the driver was rude, or they were this, or something happened. I would like to be able to document that. And so I've got Carrie looking at some other camera systems for the other vehicles, but this one came with it. So that was kind of a nice feature. It drove really nice. It's got 21,000 miles on it, so it seems like it's fairly new. It's a 2022.
What's
So-
the make and model? What
It's
is
a
it?
Kia and it's called a Carnival.
Okay.
So it's a nice family type vehicle, but it is and it's got a low entry point. So when patients are getting in from the sidewalk, it's really low to the ground. You don't have to step up into the vehicle. So that was another feature I looked for. The seats are washable. So it's, I think it kind of connected all the lines and all the dots I was looking for. And the nicest part of it is that Kern Health System is going to be writing us a check and reimbursement for it. So that's nice. We're trying to decide if we're going to wrap it with all white and put some logos on it, or if we're going to leave it that color and then just put the logos on it that way. So Bob will be looking into that this week sometime to get a quote for both of those things. We do have to put Kern Health Systems logo and Kern Valley Healthcare District logo on the sides and get that all hashed out. I would like to actually wrap the whole thing in white, and that way we can kind of match the rest of the vehicles that we have, but it is what it is. It's not necessary. So
What color is it?
it's kind of an ugly gray. It's kind of a drab gray color, but
See that one.
it is what it is.
It's the color of old asphalt.
It was the color that was available. How's that? It's the color available. All right. I mentioned in my board P&P and also in the last board meeting that we were going to meet with Bakersfield Behavioral Health Management and Leadership. We did that. We were promised a tablet to be able to contact the Met team without having to call Kern County Sheriff. We have received that tablet. We haven't used it yet, but we do have them on speed dial now, I guess you could say. So we can talk to the Met team directly if we have a need. So that should help us. I am gathering retrospective data from various dates and visits in the ER to identify if we should pursue grant funding for a particular project as it results to substance use disorder. I realize this is a hot topic in the news and even in our community, but the data that I'm seeing so far is that people rarely present to the ER with this problem. I don't see a lot of people coming into the ER. Now, the alcohol is one thing, but this grant seems to focus on caring for youth with substance disorders. And I'm not seeing a lot of youth visiting the ER with a substance use problem. So I will continue to gather data and look into that. I'm not sure when this grant has to be kind of turned in or requested, but I'll get more information on that. But there is some money available for this kind of behavioral health service in the community.
I'm glad we don't have that problem. That's good news in and of itself.
I don't think it's that we don't have the problem. It's not recognized in our facility. I would say that sometimes these grants require a lot of footwork, and is the footwork worth the small number of cases that we might see? And that's where my focus is. I know that, and Catherine probably knows as well as I do, that there is a problem in our community. It's just getting to, if it comes to the hospital, that's when I need to know, and that the hospital should apply for a grant. Maybe, College Community Services should be applying for these grants and getting some money to deal with these kind of problems outside of the hospital facility. Does that make sense?
Yeah.
And that, ladies and gentlemen, is the end of my report.
Questions or comments for Mark?
I was just going to comment, the few times I've talked to John Myers from the high school, and even some of the folks from the elementary, not the elementary, but the middle school, it does seem like there is a problem, but it's just not, as Mark indicated, it's not really talked about in our community.
Well, John, according to my tax bill, he's got a lot of money he could be spending on some of that stuff.
I agree.
Sorry.
No, I absolutely agree with you. I think that the school could do a better drug counseling program or, because fentanyl is a big crisis in this country right
Yes,
now.
it is.
So, yeah, I mean, that's just my 2 cents. But it doesn't get talked about like it should with our youth.
Yeah, he said it's a very serious problem, but nothing really bad has come out of it that much yet.
Yeah, well, and a lot of,
see it.
it seems like, this in my opinion, but it seems like a lot of those kinds of issues in our community seems like it's suppressed. I don't know if that makes sense.
Well, yeah, oh, yeah.
But I hear through the grapevine, or I hear, people that have kids that,
Well, Myers has said, I've talked to him, it's a serious problem.
Yeah.
It just hasn't got out of hand enough that we've got the problem.
here at the hospital. Now,
Mark, can you send me information on what the name of that grant is and stuff?
Sure.
Thank you.
Yeah, it's called, I'll send it to you, Catherine.
Okay,
and Mark, did you say that grant does not include alcohol?
Oh, it does. Yeah,
Okay.
it does include that.
Okay. Okay, thank you.
Mark, if Narcan's administered in the community at somebody, at a site, do you know what the protocol is? Is that like, okay, we should transport you to the hospital?
Yes. And the fact is that Narcan is so short acting that a lot of times the drug that is in their system that you're reversing is still in their system for a long period of time. So the Narcan will wear off in 30 or 45 minutes and they're back in the same problem, in the same situation.
Okay.
So yes, they do want them to come to a facility to monitor them. And we've even had patients on Narcan drips for a long period of time because they're just,
Oh, wow.
sick. So, and fentanyl being the drug of choice these days, it is reversible with that drug, with Narcan. But again, it's a short acting medicine.
Okay. So if it was happening a lot, at least if they encountered our EMS system, you would probably see them at the hospital.
Most likely, yes.
Okay. All right.
As a matter of fact, there was one individual that I uncovered with a admitted problem in that area and does not wish to seek treatment. So, I mean, you can lead them to water, but you can't force them.
Yeah. All right. Thank you, Mark.
Yep.
Okay, Dave, before we get to you, I want to check back with Barbara and see if you're ready to talk about Delta.
Yes, I am. I thought I would wait till you got through the old business, but this is fine. I pulled the last Delta bill we had. We paid $2.37.5 per gallon. And Kern River propane, the most recent invoice we had was in September, and it was $2.41 a gallon. That was a small fill. The last large fill we had from them was back in June, and the rate was $2.12 then. So I don't know if it's more expensive when they have a smaller load, or, we have a special rate with a large load.
We
It runs-
have a special rate with the large loads.
That's
Okay.
the tank here.
Yes.
It runs day to day, the cost, and most of them run according to what they pay for it, a certain amount. So
Yes.
it would need to be an invoice from us that was within a couple weeks to be able to compare. And the way that that's written, it just, no care, just as charged. Do we do that? We've got an agreement with the Kern River Propane on what their cost is.
Let me throw this out. Bob, why don't we just go ahead and replace the tank? I mean, we're not gonna be moving the tanks. I thought up to the architects or anything like that.
Well, the reason I had not done it so far is that on the plans, we have to upgrade the enclosure area of the tank as part of the rebuild process of the building. So I was just gonna get the tank replaced as we upgraded the bollards and did the work around the tank that's gonna be required by the county. But I can call them this afternoon. It doesn't matter to me. It's just that the tank was there. It takes time, a little time to get it swapped out. So we were doing some work in the building, so we had it filled so that we could have some heat in order to be able to work. That was many months ago. When was that bill, Barbara?
The Delta bill
Yeah.
was in May.
Yeah. So see, we haven't used any propane since then.
It's pretty cheap then. Okay, all right. But you plan
No,
on,
I'm
you
planning
plan
on
on
changing.
when you get the,
And our price with Kern River Propane is their cost, whatever it is, plus us.
right. It's something we sort of know.
Yeah.
Yes.
But that's what everybody charges. And as you can see, the cost between the two companies, it's not like I paid an exorbitant fee. I actually paid about the same.
I like Delta Liquid.
Yeah.
The people and delivery guys are great.
Yeah.
But we just don't want to pay, we were paying quite a bit more through the other company,
Will
I
you
guess.
purchase the tank or will we?
No,
Use the tank?
It's really not usually cost effective to purchase a tank. Though we can look into that cost, but it would be, a substantial amount of
Yeah,
money.
I
to
just
purchase.
wasn't sure.
So for instance, on our clinic, we own the tank. On the counting building, I believe that, Barbara, do you know if we own that tank or is that owned by Kern River?
I have two on my property. We own one.
Yeah.
I think we own it.
So.
Okay, so we own the other two tanks, and we can look into owning the tank on this one. It's just that I've been working on other more emergent stuff, waiting on the plan review process
Oh, wow.
with the new building.
Okay, it's just that it was in there and there was. no-
Understood.
How much, just out of curiosity, what's the
We're-
differences there?
Even if
Okay.
that was approved, it's not
I
like we're
think
locked
maybe
into buying from them. We can
Maybe
cancel at any
Okay.
time.
All right,
Or
well,
something.
Yeah.
I mean,
let's
that's
do-
not,
It's not huge.
We'll work on it.
Okay, let's do what Bob feels is best. Is that right?
Yeah, we'll work on getting it swapped out.
Okay, thank you.
So this was a contract that was on the consent agenda, so it needs board approval.
Not really a contract from what I'm hearing. We're just getting invoiced
It's
from,
just
them.
that
We don't have a contract.
invoices, so we're just gonna leave it like it is. He's gonna swap it out.
Okay, so no action by the board. All right. Very good. Then that brings us to item 6, the Chief Financial Officer report. I turn to you, Mr. Recupero.
Thank you, Ross. So we're gonna talk about the month of August. I'm glad Dr. Finstead had a short presentation because there's not a lot of new information in August. So we kept our presentation very short in Finance Committee. Before I get into the specifics here, I do want to report the last 30 days, we've had quite a bit of activity, Barbara and I, in the work successfully dealing with activity as it relates to the COVID stimulus money. For example, we finalized what was called a single audit where we got approved. This was the last step of the 4.6 million that we submitted and got tentatively approved last November. This was the final step, and that's now been approved so that there isn't really any other possibility that we'd ever have to give back that 4.6 million. So that was a positive occurrence. In addition to that, we had a new deadline to submit data for the next, it's called period 3 reporting, and we were able to get that data in and approved. In the next phase of stimulus money that we have to justify. So those are ongoing activities I wanted to keep the board apprised of that are all going well. Obviously, that's a fairly major subcategory of our financial performance is the benefits that we've received over the last couple of years as it related to COVID funds. And specifically, when we look at a lot of our bottom line, we talk about monies that are now having to be recorded as profit, where Chet was holding back until we knew for sure whether or not that money had to be paid back. So I'm kind of putting those two together. When you see it on the financial statements, it's a result of what's happening with these audits getting approved. So jumping on to page 4, in the upper right corner here is the month of August. We continue to have a number above 3 on our adjusted financial strength index, 3.12. That number has come down a little slightly from fiscal year end at 3.37, but still very good in the excellent category. We continue to show pretty strong numbers year to date, and our projections continue to look pretty good, over 3.7 million, a little bit less than budget. As we emphasized last month, we talked about the fact that we set an aggressive budget number for this year, mostly because we recognized in order for us to hit the aggressive goals that we have to still have enough money at the end of the construction project, even when it was at 19 million, we needed to have that much of a positive bottom line each year. So that number was set as an amount that the organization needed to do to keep up with what we thought at the time was the amount that we were going to need in terms of not running out of cash on the master seismic project. So that's why we had such a high budget of 3.9 million. But we still continue to perform almost as good as we did last year, a little bit down from last year and definitely better than the 2 years before that. The graphs here in terms of monthly trending, you can see that financial strength index starting to come down a little bit. Yes?
Could you make that a little bit bigger like you did last time? It's so hard to read.
Not at all.
Sorry.
Okay, so the financial strength index, you can see, is down a little bit. Net income has stayed positive, but not as high as a lot of months that we had last year. ER visits has stayed strong, a little bit down from last month, but still ahead of budget. Acute days went way down, you can see in June, but it's starting to come back up again. Because COVID is not as big of an issue, we're kind of having a more typical summer in terms of acute business. And last year in the summer was we had a higher census due to COVID. So the skilled days, we had some real starting to come back a little bit, but definitely way below our targets. But it compared to prior months, we're doing about what we've been doing the last 4 or 5 months. Just to kind of briefly address Gene's comment that I'm not planning to get into today about the new higher amounts that Bob is going to present later on the construction project. This was done showing how much money we would have each year after the 7-year master project was completed. That at the time, with our 19.6 million, we thought we'd get about 64 days of cash on hand compared to the median of 72. That number, all I would say is the new number that Bob has would put us into a negative of about 30 some days. So it's obvious that, you know, when you go up as much as we are with the new number, it's going to fall into the negative category. And that's really all I wanted to say about that today. On the accounts receivable on the next page, we do have some positive information to show you. We want the lower the better. At the end of the fiscal year, we were at 27,922 on line 4. That number came down last month to 26 million, and then down to 24.6. And I've already got a snapshot of what it was at the end of September, and that was 23.5. So we continue to see a nice trend as our business office is really getting accounts cleaned up and getting more and more money coming in on the our receivables as it relates to the insurance company payments. The next item I want to refer to is just the regular profit loss statement, page 7. So the month of August was 3.66 below budget, 10,749,000 on line 6 compared to the budget of 11,157,000. Similarly, you'll see that 3% number carried down as you go down the income statement, 3.66 on the revenues, 3.15 on the net. In total revenue on line 13, these are negative variances to budget, which means we a little bit underperformed on the revenue side. And however, on the expense side, we did go over by 24,000, and most of it was an $80,000 professional fee on this line item 17, which was a legal settlement. Without that $80,000 number, we would have been below budget on the expenses. As far as the COVID, where you're seeing that is on line 30, because we're starting to show that on the bottom line, about 167,000 a month, 2 million for the year is in the budget, and it's being shown as actual. And again, that's the catch up of what Chet didn't show earlier in the last couple years. The money came in, we put it into accounts payable. Now we're taking it out of accounts payable and counting it as COVID grant income. So that's why it improves the bottom line significantly over the year. We're expecting about 2 million of our bottom line to be related to the COVID monies that hadn't been reported yet, but it's in the budget. So 220,000 total net surplus, budget of 335. So this is a similar negative variance what we had last month. One of the things that's seasonal that we weren't expecting any money, nor did we receive any IGT money on line 39, 0. We did have 411,000 the year before. Year to date, we're also at 0 on IGT money, and then we didn't get anything in September either. So these amounts seem to come in clusters where we get a couple really big ones at the end of the calendar year, sometimes in February and then in May. So should be expecting about 2.5 million more this year in IGT, but so far none of that has come in. So that's obviously affects our cash balances. One other positive item on the expenses is we're looking at total utilities for the year of 108,956. That's line 20. A year ago, for the same period, we were at 118. So we have about 10,000 less on our utility expenses than we had a year ago. So that the new program that we have in place is really saving us on the cost of utilities.
Is that gas, or is that the electrical, the batteries?
Yeah, that's that new battery system and how we switch over at the later in the time.
4 o'clock.
4 o'clock.
Yeah.
That is terrific.
Yeah, so we're already seeing some nice benefit to that whole program. And again, the year to date kind of follows with August. So July and August were similar, a little bit below budget for both months. However, really fairly healthy bottom lines of close to $500,000 after the first 2 months of this current fiscal year. You can see on the trend prior months on line 6, we did improve the last 3 months in terms of volumes and revenues from 8.9 million 2 months ago to 10.3 and up to 10.7 in the month of August. So I don't have anything else to update you on except to point out that our overall cash position on the cash flow continues to exceed where we think we're going to be by year end. That's the far right number is what our budget is. On the green, we think originally we budgeted that we'd finish the year at 24,553,000, and our current projections right now is 25,089,000, about $500,000 better than what we have in the budget. So far there hasn't been any surprises on the negative side. The first couple months of the new fiscal year, we did receive in the month of September a nice grant. I don't know if Dina Griffith needs to get credit for it. $258,000, $250,000. It's called a SHIP grant. So that's going to help our cash position and our ability to handle operating expenses moving forward for the rest of this fiscal year. So that was a nice.
Okay, Dave, can I ask you a question? I don't know if it's exactly there, but on the news, they're saying that our employees have lost, because we're part of the environment here in the United States, 8% of their income. How are we going to make that up? We can't leave them unpaid.
We still feel good about the prospects of this ERC program, but we can't make any promises.
Overall wages right now, they're 8% from what they were 2 years ago, less, and they were able to live. Now, how are we going to bring it up to date?
So what I was starting to say is, if it comes to pass, and we expect that to happen in the next 3 to 6 months, that would result in us having a 7-figure increase that's over $1 million more than what we expected in our budgeted cash flow. That should free up our ability to do something for our employees.
That's one time. That's one time.
That'll be a one-time opportunity to make up some of that 8% difference of what the employees are having.
I'm talking about long range. They've lost 8%. Are they going to stay 8% less than they were?
A lot of it will depend on whether or not the inflation that we're seeing goes down at some point. If the inflation drops, then obviously they will begin getting that money back in their paychecks. So you want to be careful about doing something that's permanent like that. So
well, you want to be careful about leaving them 8% under permanently too. So
that's all.
Yeah. That's everybody.
Yeah, every hospital has to go to the payers and say, okay, we got to pay our costs are going up 8%. Are you going to pay us 8% more than what you've been paying us? And that's Medicare, Medicaid. The state, they have a huge surplus and they don't want to pay a penny more for healthcare. So it all starts with where the source of funds are coming in on, and in the absence of us getting huge increases from third-party payers, it's difficult for us to turn that around and give it to the employees.
So you think as we get reimbursed that 8% more, we'll give it to the employees?
Yeah, or the 65 million FEMA money that Bob's going to get us, that might help too.
Yeah, I've seen those.
It's not that we don't want to provide for our staff, but it's not just us or those of us in healthcare. It seems like in every meeting, I would love to give them more. I've been there, done that. I was thinking I should just renew my license and at $50 an hour over there. But I can't work 12-hour shifts that kill me. But I just don't want people that watch this in the community to think that it's not that we don't want to, but it's just not us. It's the world we live in today.
But we need to plan.
Well, we can plan, but that doesn't mean it's always going to happen. We talk about it often. I just don't, like I said, elections are coming up. Things may change during election times. And that's
you guys won't have to listen to me.
Well, I am going to vote. So, but I'm just saying, I feel kind of bad that, we talk about it and we know your heart's in the right place and we would all like to see it happen. But
well, I'm looking at our finances long term, and we think we can underpay our employees and we can't.
Well,
And I don't think we have to apologize for what we pay our employees. I think we do as much as we can do. And I think we stay competitive. So I don't think we should put it in those terms.
We just need to stay on top of it, Dave's what I'm saying. Things are changing around and we have to plan.
Hey, Tim,
Yes.
do you want to mention the reimbursement rates that we've seen increased or not increased in the past 10 years?
You mean Medi-Cal?
Yeah.
Yeah, we just got notice from Medi-Cal, 578,000. We got to pay them back because they thought they overpaid us last year. So we're going the wrong direction in terms of our rates going higher. They said the rates.
They gave us the money and then they said, oh, no, gee, we made a mistake in the numbers.
Yeah,
So,
Take it back.
That's why I'm cautious about, you said everything's fine, we won't have to pay anything back. They clawed that back after 5 years.
Well, and this is even a new one that just came up last month.
Oh,
Beyond
really?
that
That's a
one.
different one?
Yeah.
Yep. So yeah, those are the things, those kind of things happen all the time. And that's why we have to be careful not to commit long-term on a wage structure that we really can't afford to keep. Obviously, the security of our existing employee also has to be taken into consideration.
I know, it's just, we need to, in my opinion, is plan better for the future for that, the increases that were down. We've been giving them 4%. The average has been getting 5% rates nationwide. And so we've been at 4, which is awesome up here where we're at, but
I think the government's around 2.5%.
keep it in mind. Pardon me?
The government gives about 2.5% a year.
Right. On average, about between.
Yeah, when
So I
you-
don't know where you got that 5% number, but I don't know.
We get 4, but well, that's on the news. But when you're looking at 2.5% of 500,000 for an employee, that's a lot of damn money. When you're looking at the real people and you're looking at 2.5% of 50,000.
Well, I was enlisted, Gene. I remember the military days.
Okay, are we ready to move on to
Yes.
item G, new business?
Yeah.
Okay. So item 1 is funding for a building project. And Bob, you want to walk us through that spreadsheet?
Yeah, so obviously at building and planning, I had shared one where we had looked at possibly taking phase 1 and moving it down so that to see if we had enough money to get through the new ER already in the bank. Since then, I have had a meeting with the architect and engineers, and the only way we can move phase 1 towards the end would be to go back to HCI, because the architect informed me that the person in charge of our plan review said that no ifs, ands, or buts, we're going to do the entrance and canopy first. Now, that being said, he has retired. And so obviously there would be a chance at looking to go back to them to see if we could do that. Now, even moving that first phase down towards the end still didn't get us where we needed to be, in talking with Dave. So what I did is I moved the number, I moved the phasing around, because Dave said, show me how far we would get with the money we have in the bank. So this spreadsheet has, and I've actually issued another one, but it was only yesterday to Dave, where I broke down the dollars per year. But you can kind of extrapolate that, because I'm estimating that we would do phase 1 and 2 in 2024 and 3, 4, and 5 in 2025. So we could get through phases 1 through 5 with the money we currently have in the bank. And then obviously, that is only halfway there. So
That doesn't assume there's any more IGT money coming in or any of those stuff.
right, this is just strictly the money in the bank.
Correct.
So that being said, I do want to go back to the FEMA funding, because, I want to remind everybody that the last time 2 years ago, when we applied for FEMA money, we were approved. Okay.
But they ran out of money.
Okay, but understand that FEMA approved our plan. and then handed the money off to the state. And the state was the one who awarded the monies out. And so we didn't quite make it onto the list of a funded project. So, but I want to remind you that our plan was approved. So we're going back to them again under a different program. And in this new program, the BRIC funding, seismic upgrades of buildings have been approved in the last several years. So the other plan had never approved a seismic. So we were the first one approved that I'm aware of. Now, so now we're in a plan, a FEMA plan that has approved seismic upgrades in the past. So I would say, you know, there's a fair chance that we could get this funding. Obviously, it's going to take a period of time. You saw the timeline of, you know, I have to submit by end of year, and then we will not know until like August of next year whether we are approved. This time, we are submitting directly to FEMA, whereas the last time we submitted under the other program, we submitted to Cal OES. And yes, it went then on to FEMA, and FEMA blessed it and sent it back and with the monies, but then that's where we were. So obviously, you know, to answer Gene's question, if we can get the BRIC funding from FEMA, we're home free. We have to pay 30%. And right now, worst case scenario, we're at 36,336,800 on this. So 1/3 is what? 12, 13,000, 14,000 million, I'm sorry.
And that 12 million obviously would only cuts our current balances in half. So we would still have a very healthy amount of liquidity if in that situation.
Absolutely.
We could pay off our debt.
We could pay off our debt and then really make sure that we stay competitive with salaries and everything else.
Yeah.
But Dave, can you look at what it would cost if we don't get that? We have, you know, right now, before at the 19 million, you were saying we might be able to make it. Now it's twice as much.
Yeah, and we recognize that we're not going to be able to move forward in the same way that we could have if we thought we had enough. You know, that's going to have to be decided on whatever process the board wants to put together on how to decide how to move forward in terms of how much to do right now versus holding off.
So Bob, the way that you broke this down to phase 1 and phase 2, so you did exactly what we asked you to do, is come back with what we've got the money for now, because we've got money in the bank to do it. So you're showing us what we can accomplish with what we have today. And then it shows us what our gap is, what we need to come up with in order to finish the whole thing. If there was no more money coming in for some reason and we were left with just phase 1 to do, would that leave us with a usable building? I mean, we could operate?
HCI required us in each of these phases to have a fully functional building during every phase.
Okay.
So to answer that question broadly, yes, but obviously you see that the new ER is in the phase 2.
Right.
That doesn't mean that we might not be able to raise, you know, another $7.5 million one way or another and make it through the end of ER and maybe not move the CT scan inside and not finish off the final acute care. You know, these are some tough questions that we're going to have to wrestle with if we don't get the FEMA money.
Right.
And I will say this, you know, we applied 2 years ago, we got approved, didn't end up getting the money. We're going to apply again. FEMA will only award money on projects that have not started construction. So this is our last shot at FEMA money.
Right.
Because if we start construction, I can no longer apply to FEMA because it's an unequivocal hard no if you've started construction of a project.
And just to give Gene a couple other examples, and again, the strategies going forward is somewhat in a brainstorming type of phase. It's not like we've got it all nailed down to the penny, but just as an example of another source of funds was the research I was doing in the last week. I'm excited about the opportunities with interest rates going much higher, that doing a more aggressive job of investing our current funds. I'm looking at anywhere from 1.5 to $2 million of increased interest income generated from our investments.
Wow.
So that's just one example how we can cut into that gap. In addition to that, Gary Hicks has assured us we probably have some increased debt capacity, 5 to 10 million, that we could also look at. But my point on giving you those as just examples of the kind of brainstorming, stage we're in right now. I don't have anything specific I'm recommending.
So Gene had alluded to this earlier in the day. And can you kind of dust off your crystal ball? And the next time that we meet, probably our building and planning meeting, kind of give what you think our revenue picture is going to look like through 24, 25, 26, and 27 to see, through IGT programs, through possible interest on our investments, what our financial picture is going to look like.
Sure. Yeah, and just to forewarn you, I'd be glad to do that. Some of the numbers are softer than other numbers in terms of how many years you go out, in terms of knowing things like, can we get our SNF volume up to 60 and stay there? Those kind of examples. Can we get GI really going again? Are we going to be successful at all the IGT money increases that we are hoping to get? Those are all soft projections, but they're clearly, based on what we know today, types of projections.
I'd like to understand if it looks like it's actually within our ability to accomplish.
Yeah, because the downside, obviously, if I give a real optimistic picture and then it doesn't materialize, then we've move forward with a commitment that we may or may not be able to accomplish.
Right.
If we do the ER sooner, that's the thing we have to do. Then we could draw out. It might take 20 years to get everything done. Bob might be retired by then, and his son could probably take over.
Yeah, I'd be 87.
You can still do it.
But with right now, none of us, I don't think, have a crystal ball. We just got a plan,
And I would love to move the ER sooner. The problem is that state says you got to do this part first. Now we can request phase 1 to move, but other than that, each of these phases have to follow each other in order for the infrastructure build out to work.
right. But if we don't do the ER first and we get caught where we have to do it, and nobody wants to help us, what do we do? We're out of business.
If we get through phase 5 and we can't come up with additional funding enough, we could do a scale down renovation of the ER that would cost substantially less and still
Just a $1
some-
million project that we could actually do now.
right.
Okay, all right, yeah, okay. Just so there's a way out, whatever.
There's always a way.
Well, and unfortunately, if we miss on our projections, it is somewhat consequential in that as soon as we start going below 10 million in liquidity, then all of a sudden we start potentially running into a distress status again, because you're going from hand to mouth, and all of a sudden you've spent all your money and you still haven't finished the project. So that whole picture does not look like one that we want to go into.
Right.
Yeah, I mean, check with Adventist Health, who's running Tulare Hospital.
Yeah.
It's got a shelled wing that they can't afford to finish.
So whatever I give you, I'm going to, obviously make sure you understand that, these projections are not guaranteed.
Oh, well, I thought you said you would guarantee everything you said.
So Sally in skill, she's gonna give me 60, next 5 years, guaranteed.
Sorry, thank
Okay.
you for addressing my concern.
This is another piece of information that's really helpful. Thank you.
Thank you, Bob. Yeah.
Any other board member questions or comments on this item?
We have challenges ahead. Let's just get through them.
Okay, then that brings us to the grand jury report. I'll turn it over to Tim.
Well, again, I wanted to get this out to you so you can see kind of where the grand jury came from with their review of us. It's heavily weighted towards the construction project. I think some of the members of that team that came up here were wannabe architects and so forth. Bob and I spent quite a bit of time with them, you know,
It was
and
interesting.
you know, it's like I said, the report, and I worked with them numerous times to get them to modify this report. Just to try to even put it in kind of a timeline sequence. They kind of bounce around in terms of, you know, again, we got the mobile health, the mobile clinics and the vans, you know, and stuff like this. Then the next thing they're talking about putting a sniff in, and which was 20 years before that. So again, it's all in all, it kind of represents where we're at and what we've been through and so forth. You know, when you get towards the end of the recommendations and so forth that came through, I responded to each one of those. I've included my responses on the last 2 pages there. In essence, you know, for the most part, I agree with what they're saying. My issues were more in line with where they were being specific about, you must hire this person by this date. You must have by November 1st, you must have a project manager hired, you know, and I'm going like, why would I do that until we know the plans are back and ready to be, you know, building permits are ready to go. Same thing with the construction manager. They wanted to have that done by February 1st. And I said, listen, I agree with your principle that we should have somebody in charge from a project perspective. We obviously are going to have a construction manager over the project. But again, I just can't commit that I'm going to do it by your dates and so forth. And so most of this, as you can see, have been pretty much in line with that. They talked about the duties and responsibilities of a construction manager. Again, you know, it was those duties and more from my perspective. You know, and most of it, I just thank them for their recommendations and so forth. The one thing, like I said, at the very end there, they kind of talked about just something that we were doing with our board meetings. And that was the fact that we had been approving the committee minutes at the board meeting. So we would accept the reports that came through but they hadn't gone back to that committee to approve their own minutes. So what they recommended that we do is that at the board, we accept those committee minutes pending approval by the committee the next time they meet. So, and that way, if there was any significant change that was made to the minutes, that would come back to the board and then we'd modify that and so forth. But they said, just in keeping with the the state requirements and so forth, that's the way we have to do that. And when I brought it up to Heidi, we immediately changed that. And it's been that way since that recommendation was made. So as a matter of fact, even in this meeting today, you'll see that the board accepted the committee's reports and pending their approval at the committee next time they get together. So
Okay. Did I see something in there about you have eliminated finance committee out of the building construction project? Totally.
They just wanted to make sure there was a process in place to review the construction dollars
Okay.
spent on
Did
construction.
they say it was okay to eliminate the finance committee out of the building?
They didn't talk about that. They just said they just need a mechanism in place to review those.
Is there
meetings.
somebody I could call and find out, get it specific on what the questions were?
Those are the
Because,
questions.
well, no,
their
that's the
report.
question. Ross says, well, there's 5 of us there, but it's not the finance committee.
That's not then in the grand jury's purview. That's just
Okay, well,
purely
it might be.
our purview.
Let me put it that way.
Well, only if you're going to go to the grand jury and make that a point.
Okay,
But
okay.
Okay, but this is a finalized report and so forth, so,
How long have you had this report?
a couple months.
Why didn't you let us have a copy of it? So
I,
we get this Friday.
yeah, I.
Tim,
appreciate
that's-
that. I agree with you. I agree with you. So I appreciate that, and I should have done that earlier. So,
So
I thought we did get it earlier.
we got
I
it
thought I had
Friday.
sent it out, but apparently I hadn't, so
Okay,
we could not find.
Did anyone get it?
I did.
Okay, when did you get it?
I don't know. A long time ago,
Why
Right-
didn't? you're
right
a
after we got it.
Leader, why didn't you make sure we got it?
I can't send it to you because it's a Brown Act violation. I just assumed everybody got it.
Okay, so then it's Tim's fault. He didn't send it to everybody. I guess, but at any
We'll
rate,
take that responsibility.
I thought you did a really masterful job at the response back. Honestly, I thought the grand jury was way off the mark here. Way into the minutia on our construction project. It goes way beyond what their purview is, and I think they're way in left field.
Yeah,
The only recommendation they provided that's of any value to us has to do with the agendas and the minutes. But all the construction stuff, mind your own business. They're no experts in construction and tell us that kind of detail, way out of line for a grand jury, I think.
so what they
Agreed.
did is just a recommendation, don't mean nothing.
Yeah.
that's correct, yeah. They just have a duty and responsibility to go out and review public agencies periodically and issue a report back to the board of supervisors and to the courts.
Yeah.
So that's all.
In my mind, and maybe I'm wrong, maybe I misunderstand their role, but I thought they're looking for graft and corruption in the use of our money. Not the details on a construction project. Why didn't they delve into the finances and look at our audits and that kind of thing? But whatever.
Initially, their approach was they went on, before they even came, they went online and they were looking at our website. They were looking at our meetings and stuff like that. They kind of went and looked at some of the minutes, of the things that were publicly available to them and so forth. And so they came in kind of with questions based upon that review that they had done. So it was pretty heavily weighted by the time we got to us. So.
Okay. Well, anyway, thank you I thought you did a great job on the reply back. I'm good with it for sure.
And now if I get a chance to read this, like I said, I've had it Friday and I've got questions. Maybe we could talk about it at one of the other meetings, or I could.
If you want to, yeah, no problem. Just let me know. We'll put it on the agenda.
Okay, thanks.
Okay. So this is just to receive and file. Does it require a motion and approval to receive and file? It does.
Well, I don't know if the other board members, I haven't had a chance to look at it, and I would like to look at it and talk about it more before I say yes to receive and file, because we're talking about, we're gonna ignore them. That's the drift I'm getting.
Well, we can receive and file the document, Gene, and it doesn't preclude us from discussing the contents later down the road.
Okay, so we're just acknowledging we got it?
Yes.
Yes.
All right,
And do you want to put it on another meeting, like the buildings and?
yeah, I'd like
Or-
to do that, but right now, if it's just acknowledging we received it, I guess there's nothing wrong with doing that, is there? Or,
I would think not. We can just determine where we want to talk
Yeah,
about it
but-
again.
well, once I have a chance to read it, and I don't, and you might have questions, I know you got it Friday too.
I did get it Friday.
And so, but right now, if we make a motion to receive and file, it's not gonna make any difference after we talk about it.
It doesn't preclude us from taking action down the road if there's something in there that you want to take action on. This is just The grand jury issued their report, and Tim has filed a response to that report on our behalf. So we're receiving and filing those two documents.
Okay, I'll make a motion. We accept or do the receive and file, however it is.
And
Is there a second?
yeah, I can second that. But my question is, can we decide where we want to speak to it again?
Right, under old business, probably.
Yeah, we could do it on the next board agenda, old business. If it's something you think is time sensitive, then we could do it at a building and planning meeting.
Yeah, I don't know that it is, but I just don't want it to be just,
Yeah. If there's something in there that you want on the next board agenda, let me and Heidi know, and we'll make sure it's on there.
Okay, thank you. Okay.
So we have a motion and a second. Any more discussion? Any member of the board or any member of the public wishing to be heard? Okay, then Fred, your vote.
Yes.
Jean,
Yes.
John,
Yes.
Catherine,
Yes.
and I'm a yes. Which brings us to item H on our agenda, which is director's comments on items not appearing on the agenda. Catherine, I'll start with you.
I actually just want to say that it's been a year of learning experience for me. Not that it's been a good year of learning experience, but it has been a year of learning experiences. And I'm grateful for it. I also want to comment on those that are running again for the board. I wish you luck because that's coming up. And it's just been a privilege to sit on the board with you guys.
Thank you. John?
This is for the sniff. Sorry.
I don't have anything specific today, Ross. Thank you.
All right. Jean, Director Parks?
This time I think I'll just pass on comments. And Dave, I know you've got a tough job and you're doing it well. Thank you very much. And the rest of the board members and everybody, there's nobody in here that's not doing a great job. So that's the end of my saying nothing.
All right, Jean, thank you.
That's just.
Director Clark?
I am speechless today, guys. I'm still trying to absorb what we're looking at on this construction project. So it's going to be challenging for all of us. We need to have a little bit of patience here. And
Thanks,
Dave,
Fred.
my crystal ball, you're welcome to it, but it is cloudy.
I echo my colleagues' sentiments. It's a pleasure to work with all of you, even Jean, most days. And I think we're going in the right direction. It doesn't mean there aren't some bumps along the way, but look what we're accomplishing. I think we're doing a good job for the community. I feel good about it. It's unfortunate to have those numbers finally to see what our gap is from the beginning to the end of our construction project, but having it in black and white and seeing what our gap is the first step of figuring out how we're going to do it. So again, we're going in the right direction, and I appreciate everybody's work on this. I don't know if I'd mentioned before, I did have the opportunity to visit our hospital as a patient, and I really received excellent care at this facility, and I'm so appreciative of everybody and the teamwork that's happening at our hospital. It's a phenomenal place, and having experienced it firsthand in my time of need, I got great care, and there was nothing lacking. Yeah, it's a fine facility, and I'm so appreciative to be part of this. So thank you all.
Appreciate that. Thanks. We'll pass that along.
Catherine, I did send that grant to you. I
Thank you.
sent it to your email, and also if you want to stick around, I'll show you the van.
Yeah, I like the color.
Okay.
All right, everybody.
And Ross, your picture is posted as a VIP, just so you know.
It's only because I know Heidi. All right, everybody, we're adjourned. Thank you.
Thank you.